to understand the concerns of industry stakeholders and advised me to table key recommendations that would bolster Africa's CDC programs to build out a fully capable workforce on the continent. As I recently announced, they have also fostered strong partnerships, also a pillar of the new public health order, by working in close collaboration with civil society through AMREF, working with business through the Serum Institute of India, and also applied academia through the Sept Global Health. This is truly reflective of the multi-sectoral collaboration we always talk about, which yields tangible results at speed. Amongst the key learnings from stakeholders is that the continent needs to undertake a thorough gap analysis of the health workforce, which is particularly sensitive to the working realities on the ground, especially in the primary healthcare setting. Amongst this is also to acknowledge the key targets of 2 million community health workers by 2030, 6,000 epidemiologists, and also 25,000 frontline field epidemiologists. These are the targets. Stakeholders have also explained the importance of sustained investment through a pooled mechanism to avoid duplications, fragmentation, and a silo approach to health workforce development. They highlighted that it was critically important to standardize and homogenize accreditation to ensure maximal capacity for deployment, both within the continent and also to serve the world as a whole. It became clear that the issue of health workforce development required a medium-term dedication that would sustain inwards investment, training, deployments, and also retention to provide member states with bridge support until such time that they can accommodate the growing health workforce within their fiscus. It was through the revelations of these consultations and consultative sessions that we tabled a recommendation to establish a health workforce task team that would undertake this role in support of member states who are recovering their economies and also pursuing the Abuja Declaration to increase health spending in their respective sovereign states. The task team would see to the interim measures required to support growth by facilitating bridge financing and fostering a compact amongst member states that homogenizes policies and actions around issues of workforce needs, labor markets, gender parity, public and private partnerships, monitoring and evaluation, and also emergency response. To ensure that this work is supported and driven by sound evidence, a foundational team is currently being established to draft the compact, design the mechanism, and devise strategies for the bridge financing, and also increase domestic spending into the future. This work has been financed with the support of the Serum Institute of India. I am impressed that a manufacturer has seen the value of investing in people who ultimately deliver their products to patients. And I call on all other business and philanthropic partners to follow their example. We believe that while collective centralized action may be ambitious, it will yield better results and tangible ground impact. The AU has the structure, political will, and enabling technology to coalesce around this critical issue of health workforce development. I want to thank my colleagues who have joined me in this high-level panel, of which I have the honor to establish. Your support is a real show of force to the world that the AU leaders take this issue very serious. We are clear about what needs to happen, how it needs to happen, and what responsibilities member states will need to commit to those responsibilities for sustainability, ability to retain the health workforce, and also for future growth. We implore all sovereign states, regional and international partners and agencies to stand behind the AU mandates and support actions we are taking towards tangible results. We truly believe that alignment is key to the success, and that the success that the world will gain from a strong Africa health workforce. I wish us all very successful deliberations in this session, and call on all of us here today to maintain attention and energy as we build the momentum behind this critical agenda. I thank you.
Thank you. Thank you very much, Minister Fala, for presenting that message from His Excellency President Cyril Ramaphosa, President of the Republic of South Africa. It now gives me pleasure, and it's my honor to invite the chairperson of the African Union Commission to make his remarks.
Your Excellency Ellen Sirleaf, former President of Liberia, Your Excellency Minister of Health of South Africa, representing His Excellency President Cyril Ramaphosa, President of the Republic of South Africa, Your Excellencies, Ministers, Commissioners, Ambassador Dr. John Kengasong, Dr. Ahmed, Acting DG of Africa CDC, representatives of partners, distinguished guests, ladies and gentlemen. It is my pleasure to be here today to celebrate the essential life-saving work of our health workforce on the continent. The COVID-19 pandemic, the 2014 Ebola crisis in West Africa, and other disease outbreaks in Africa have not only exposed the acute shortage of human resources for health in Africa, they also underscore an urgent truth. Our world urgently needs more well-trained health workers where they are most needed, but they also urgently need more support. Some 180,000 health workers worldwide died from COVID-19 between January 2020 and May 2021. And others left the profession altogether due to exhaustion and burnout. On the continent, the loss is further aggravated by brain drain